Hi, I'm Dr. Rob, and this week we're going to be talking about acupuncture. The basic premise of acupuncture is you're trying to balance the body's energy system. So it can get complicated because like Eastern medicine and Western medicine have different definitions of healthcare in general. So some of the same definitions just can't be used. But basically it's just trying to balance the energy system of the body. You have different meridians of the body that correspond with different organs, and stress on those organs can throw meridians out of balance. So everything is just a matter of balancing everything throughout the body. There's no real perfect, like this person definitely should get acupuncture. It's one of those, there are a lot of different people who just respond better to a lot of different therapies. It's really just a matter of kind of finding the right person for it. Unfortunately, there's times where that kind of comes with some trial and error. In the office, we'll use it more of a like pain modality a lot of times. So I do low back pain and neck pain a lot, knee pain, shoulder pain, things like that. Those work really well. But the major idea with acupuncture is you're not necessarily treating conditions. You're really trying to balance the body's energy system, like I was saying. And what that does is that will alleviate conditions for people. Generally, I try to start with kind of like a 6-visit trial of care with them, and that by the end of 6 visits, you're either going to know it's working or it's not working. So if it's not working, you got to find something else. If it is, great, you can kind of stick with that. We have a couple of patients where we have definitely found with the combination of chiropractic and acupuncture, they seem to get better and stay better a lot longer. So there are people who specifically request that they have that in addition to. For athletes use more something called dry needling, and the basic premise of that is you find like trigger points in the body. So areas of scar tissue or adhesion in the muscle, you can put a needle directly into that and it breaks up the scar tissue and it starts to kind of alleviate a lot of pain for people. In acupuncture, they're considered ashi points, where they're just really tender spots, and that's kind of where you would needle with it. But it's the same kind of premise. So we do see some athletes who do some dry needling.
Hi, I'm Rainey. Welcome to the Fitbit of the Week. This week, Dr. Rob is talking about acupuncture. So I'm going to go over the importance of breathing, and I'm going to show you a breathing technique that you can do on your own. And why are we doing this? It's because most of us actually breathe in an improper way. We are usually shallow chest breathers. So why is breathing important? Why are we focusing on this? So having the proper breathing technique, it's important because it is affecting your respiratory system and your nervous system. You know, it can help calm you down and manage your stress, but it can also, it's been proven that it can also aid in medical treatments. So you can tell it's important to have the proper breathing techniques. So obviously, if you're not breathing in or out correctly, you're not breathing in enough oxygen and you're not expelling out enough carbon dioxide. So another reason that I'm going to show you that breathing technique, it is a deep breathing technique, so it's going to kind of show you how the importance of breathing in that extra oxygen and letting out that extra carbon dioxide. So also, I'm going to add in that this breathing technique can also act as a lymphatic pump. So healthy breathing mechanics are directly responsible for pumping the lymphatic system. And the lymphatic system is responsible for flushing out toxins. So obviously, again, you know, healthy breathing mechanics is going to help you release those toxins out of your body. So that's another reason that this is important. So before I show you the technique, let me kind of explain it a little bit. It's kind of complicated. So I'm going to be lying on my back, and then as I inhale, I'm going to point my toes down, and I'm going to lift my chin up. So all as I'm inhaling deeply, and then I'm going to take in as much breath as I can. Then I'm going to hold it for like a count of 3. And then as I exhale slowly, I'm going to tuck my chin back down towards my chest, and I'm going to pull my toes back up towards my body. Okay, so you'll kind of see that as I'm doing it. So let me give you a little go around here. So lying on my back. So just in a comfortable state or whatever. And then now I'm going to begin. So. All right, so I just did it a couple times, but basically what you'd want to do is do it for a whole minute. Again, just focusing on breathing in deeply, letting out slowly. This is kind of complicated. There's a lot of components going on at the same time, so it takes a little bit of getting used to. Also, if you start to feel lightheaded or dizzy, make sure that you stop. Don't go any longer than that. But that's been this week's Fitbit, and we'll see you next time.
Okay. So we walked through some of the common questions we get about acupuncture earlier, and now what we're going to do is we're going to show you a very simple treatment on Anna. She has a little low back pain, so we're going to be focusing on her low back today. So I'm going to have you face down forward. All right, let's get everything. Bring this up a little bit. Keep it where it is. We are going to clean the area with an alcohol pad just to make sure we're good there. All right. Now, stays. You're good.
Okay.
So with these, if anything's uncomfortable, let me know. I can move the needle around a little bit.
Okay.
What we're gonna do for low back pain, we're just pretty much gonna go to the side of the spine. So we're gonna go right here. Any problem? Did you feel it? Didn't think so. Still doing all right? Have you felt any of them so far?
I haven't felt anything.
There we go. So what it would be now is you would essentially lay there for about 20 minutes. Just lay there, relax. If you move around too much, you can have the needle bend a little bit with a muscle contraction. So at this point, I would generally come back and, about 5 minutes, something like that, kind of see how everything was going. There's going to be the muscles, so like we talked about kind of with the, like with dry needling. So essentially getting into those little trigger points in the muscle and kind of working there. But also one of the meridians comes down right here, and it is really involved with like spinal pain in general. So that's why we would focus here. The things you want to look for when you're going to get an acupuncture treatment is you really want to make sure it's a sterile environment. So all the needles we use, they were vacuum sealed and they're completely sterile when we get them. And you really want to make sure that you have a clean surface that you're working on. So making sure to clean the area with an alcohol pad. So on our website at WellnessLab.tv, we do have a PDF of different acupressure points you can do at home.
To submit a question, watch a past episode, or to find out more about the Springfield Wellness Center, check us out on Facebook, subscribe to our YouTube channel, or find us on Instagram, or check out our show website at WellnessLab.tv.